Welcome back to the Hot Flash Diaries Podcast, episode 9, where we have the pleasure of having Dr. Fallis on the podcast. He is a highly experienced physician with over 35 years in practice across multiple specialties in Canada. He began his career in family medicine, but quickly broadened his focus to include emergency medicine, urgent care, and then later medical education. For over 8 years, he served as the medical expert on Cityline, which is Canada's top daytime talk show. Was also one of the first physicians in Canada to offer the non-scalpel vasectomy and has performed the procedure for over 18 years. He has authored 2 Canadian best-selling healthcare books under Your Home Doctor brand, and he has spent the last 2 decades supporting patients with drug and alcohol issues as well as opioid-induced androgen deficiencies. With a lifelong passion for men's health, Dr. Fallis has counseled thousands of men on their physical, mental, emotional, and of course, hormonal well-being. He now brings his vast knowledge and experience to a broader audience, offering insights into testosterone optimization and integrative medicine. We are so pleased to have you on the podcast today, Dr. Fallis, with your expertise on all things health, wellness, and hormone balance. Thank you for being here.
Oh, thanks for having me on. I've been waiting for this.
Well, we're excited. It's been great. We've known each other now for a handful of years, and every time that we have chatted or have done a webinar together on health and wellness, I always learn something from you, which is amazing. And what I really wanted to have you chat about today was really the difference between sort of a health span and lifespan perspective. Now, our last episode, we had Greg Hetherington on, which you also know, and he touched a little bit on the differences between the two and really focusing on why, physical wellness is such a big part of having a beautiful lifespan and being able to get up and move around and be active, and have that longevity that we all want. But I know that you've chatted a lot about your widgets of health and how they sort of all intertwine and how they're a big part of overall wellness and how they can help us get into our 80s and even become a centenarian, right? And be able to live into our hundreds and be able to be around and enjoy life as it is, right? So I'd love for you to share your widgets with us.
Okay. Well, I usually start with talking about longevity because that's really what the big hot button topic is right now in medicine and in integrative health especially. And longevity really encompasses both the quality and the quantity of our life. So when we talk about lifespan specifically, we're talking about something we all understand. How long are we going to live? Like, what is our expected length of life? And that's great. It's important. How, what the average number of years a person's going to live. But probably as important or more important is what's called the HALE, which is the health adjusted life expectancy, or what we now call as health span. What's interesting in Canada, for men specifically, and it just went up, increased slightly. Our life expectancy went up. So it went down over COVID. It's just coming back up a little bit. But men sit at a life expectancy of 79. Women in Canada have a life expectancy of about 84. So there's always been this discrepancy between lifespan for men and women, and that's across the world. That's a global phenomenon. In Russia, it's of almost 10 to 15 years difference in health between men and women. But in Canada, it's about 5 and has been, for quite some time. And people will debate this forever as to why there's that discrepancy. But there's probably an element of estrogen that helps in cardioprotection for women. So that's part of it. But then life choices that men make don't help either. Our reluctance to go to the doctor, or what I call our delay, deny, and deflect approach to healthcare doesn't help us. But the important thing is the health span in Canada is the same for both women and men. And the health span for Canadians is 69. And so what does that tell us? I mean, it tells us basically that the last 5, 10, or 15 years of our lives for Canadians, from 69 on average on, is living with a disabling condition, a disease or a disability of some kind that impacts on your ability to do the things you want to do when you get older, as we age. So that's really 4 years after most people retire. They're already having a disabling disease that affects the things that they want to do as they get older in life. We need to change that. We need to really close the gap between the health span at 69 and the lifespan of 80 for men or 79 for men and 84 for women, and bring those closer together. And we need to do what the studies of centenarians in some of the blue zones in the world do, and that is they have a long shelf life. They live a long life, and then they die quickly, which is ultimately the goal, in all humans, is to live as long as we can, but to be able to do all the things that we want to do for as long as we can do them, whether it's gardening, picking up your grandchildren, or playing sports, playing tennis, doing whatever you want to do. Those are the things you want to be able to do right till the end. And then when death comes, as it does for all of us, not to have a prolonged, but a very short period of time where you have incapacity, you're incapacitated, and then eventually we all pass away. That's really the goal. So it's closing that gap and learning from the centenarians in the blue zones, but also we all know kind of by looking at the studies of what kills us in Canada. And I talk to men about this all the time, and aging is still the strongest risk factor for all age-related diseases, right? So nobody dies of old age. That's important, because we used to think that they just died of old age. No, they didn't. But they died of something that was because of the age, because age increases the risk of everything between heart disease, cancer, stroke, COPD, pneumonia, diabetes, doesn't matter. It increases the risk for all of those things. Aging is the strongest risk factor for disease. So if we can affect that, if we can change the aging paradigm, we can change the dynamics of disease in that person. And there's lots of things that we can do to help. The other really kind of important thing, I think, is the fact that only 15 to 30% of your longevity is based on genetics. So that
Which we
means
used to think it was a lot more, didn't we?
we used to think it was way more than that. So what's interesting now is, let's say 75% is in your control, right? 25% you can't control. That's genetics. You may have, cancer markers or dementia markers that you can't fight. But there's lots of things that we can do that are going to help improve longevity for people and improve that health span so they can live a healthy, productive, enjoyable life right up to the end. So, and then the ultimate
That's what
goal,
it's about, is the quality of life, right? That's really what it is. And like you said, we want to live as long as possible, and then things end quickly, not that we're suffering for 5, 10, 15 years until the last day. We want to enjoy all those things that we like to do and have a good quality of life. Like, there's nothing worse than imagining a poor quality of life, especially for that long. It's terrible.
No, and it's kind of a newest concept too, right? We've been talking about life expectancy for, hundreds of years. And so we always compare back to what it used to be, right? And what was the life expectancy at, the early 1900s? And now look at it now, like it's fabulous. Like in some of the countries in the world, it's 85, 89, so it's fabulous what we've done with that. But there's no point in living to 84 or 89 if the last 10 or 15 years are, you're bedbound or you're incapacitated or physically or mentally or emotionally. We really, this new concept of a health span, I think, is really important, because that's like you said, really what we all want.
Yeah, exactly. So tell us the things we can do.
The first things we got to know is what kills us. So the things that kill us, so when we're talking about men, let's go to men specifically here. We know that the number one cause of death in Canada, now this is not globally, the cause of death for men is cardiovascular disease. But in Canada, it's not. Canada, it's cancer. Cancer's the number one killer. 27% of men die of cancer. And then when you throw in heart disease and strokes or cerebrovascular disease, you're looking at essentially 50% of men will die from either cancer, heart disease, or stroke. So everything we do should be revolving around improving those specific things. Okay. The other thing that's a little bit different for men than women is accidental death. So that's number 3 for men. Accidental deaths, because they drive cars too fast, or because they, take drugs or alcohol more than others, or they smoke more, or because of work-related accidental deaths. So there's lots of reasons for that, but that's a category that men have that women just don't. Thankfully, the COVID-19 cause of death is dropping off, and it has dropped by over 2/3 in the last couple of years. So that's good news. But when we look at overall all the reasons that men die, and women too, 7 out of 10 are affected by metabolic dysfunction. So that means that we can control 7 out of the 10 of the leading causes of death for men and women can be adjusted. Because, as we know in North America, obesity is 65% of the population, and diabetes or pre-diabetes is now about 45 to 47% of the population in North America. So if we can control some of those things, we can control a lot of the causes of death and improve the health span for almost everybody.
It's true.
So
Well,
then when we
metabolic
talk,
disease is definitely out there. And we know so much more now that it's not just diabetes, right? Especially
that's right.
practicing more as a functional medicine provider, looking at things like insulin levels, right? Fasting insulin levels, looking at inflammation, all of those things are early markers to let us know that there is some more metabolic derangement happening so that we can help guide our patients to make some changes that will benefit them long term, right? So we never really used to talk about metabolic disease. It used to be simply just diabetes, but we know that metabolic disease really does affect everything. It's not just diabetes, it's heart disease. It's every single organ in the body is affected by increased amounts of inflammation. Which is essentially what metabolic disease causes, right? So it's quite fascinating. And the more we learn about that, and the more we can guide our patients to make good changes and impactful changes.
Yeah, absolutely. And it's a self-caused thing, right? Not just individually, but as a society. Metabolic dysfunction or metabolic disease or even diabetes, the incidence of diabetes has exploded in the last 30, 40 years. Why has that happened? Well, it's not just because everyone's eating more potato chips, burgers, and fries, and and more sedentary. There's been a fundamental change in our diet and in our food production and in our food supply in North America and Western Europe specifically. And that, especially in the US, but not so much, but also in Canada, there's been a fundamental change in what foods we're eating and how healthy those foods are or aren't for us, right? So
long term, yeah, exactly.
yeah, and a lot of it's based on subsidies. You just have to follow the money, see where the subsidies are going, to various food areas in the United States and in Canada, and you can detect kind of where the problems have arisen from. So when we talk about the solution, I talk to guys about what I call my 10 widgets of wellness. And first of all, a widget is kind of this small but integral part in the performance of a more complex machine. And the complex machine is us. And a widget is like each of the little tiny things that you can do that make a difference. Because as we know, there's not one pill that's going to make us healthy and live, a longer, healthier life. You got to do the work in order to make things happen, to improve the situation, right? So
that's right.
And the number one is exercise. Like exercise is by far the most important aspect of a long, healthy life. And whether you're tracking, VO2 max or grip strength, or whether you're tracking, how many sit-ups or push-ups you can do, or, bar hangs or things like that, exercise, or what I call movement as medicine, is the most important thing. Probably as important as quitting smoking. Yeah, so that's number one. That's always the most important one. And it's, in Canada, we're supposed to do 150 minutes of exercise, vigorous exercise per week, moderate to vigorous. That's like 21 minutes a day, actually. So we should all be doing literally at least a half an hour a day of some type of exercise. That would be very helpful for lots of people. And then when we talk about the various kinds of exercise, whether it should be cardiovascular or resistance training or balance and flexibility or things like that, that's a different rabbit hole we can go down. But basically, everyone needs to be moving more, and that would help a lot. So personally, I try to do exercise every day. I change it. So it may be hockey twice a week, and then, playing tennis or going to the gym or, riding my bike or doing something. But I try as a personal goal to try to do something physical every single day. And that helps with stress, but it also helps with, keeping you moving, right? Keeping you healthy. So that's
Well, we
kind of
did
my
chat a lot
approach.
about that the last episode, I was chatting with Greg about, what are some small sustainable changes that people can make, if you're going from literally couch to movement, what does that sort of
Yeah.
look like? Because it can be overwhelming, I think, when someone's quite sedentary to think all of a sudden, oh my goodness, now I've got to incorporate 30 minutes a day. But even if it can start off slow by 2 days a week, then adding in the third day, because, inevitably you're going to start feeling better and those endorphins start pumping and you're actually going to start to want to do things, right?
Yeah,
And we
exactly.
talked a lot about walking. And while Greg is, a huge fan of walking, he says there's different types of walking. There's sauntering, there's a relaxing type, stroll, but then there's an exercise type walk where you are huffing and puffing. You've got a rucksack on and you're really elevating your heart rate. And that is truly what's considered exercise. And, I never appreciated walking before I met John. John loves to walk. And when he walks, it's like I feel like a child behind him trying to catch up because he walks so fast. But it's a great form of exercise, and great stress relief too. So
Yeah,
even something
absolutely.
as simple as getting out and going for a vigorous walk, even twice a week to get started is a good place to start, because again, it's
Absolutely.
that overwhelming feeling of I've got to make all these changes, and then it's no longer sustainable, right?
Yeah.
So a little bit at a time goes a long way, and then you start seeing some gains and it makes you want to do more and more, which is exciting.
Yep. Yep. And then always doing, I mean, if you can do it with others, it also makes it a little bit more sustainable as well.
For sure.
Going for a walk with friends or a group of friends and making it a social thing. The social thing is as important as the exercise, really. So yeah, that's number one on my widget list. Number two would be a diet. I call food as medicine. I think diet is really important, and there's lots of good studies out there as to which diet we should be following, which are safer and healthier. The Mediterranean diet always in the top three, has been for years. It's sustainable. Families can do it. Kids can eat it. Adults can eat it. It's easy to cook. It's easy to consume, and it's healthy. And there's a reason why 2 out of the 5 blue zones in the world are on the Mediterranean basin. So they know how to eat, and they know how to eat healthier, I think, than we do. And it's
Sure.
very straightforward, really. It's more vegetables, more seafood, less red meat, extra virgin olive oil as the fat source, some fruits, but not a ton. But just kind of, and then some carbs as well, but not as many carbs as we consume. So, and it's all whole foods. They tend to stay with whole foods as opposed to refined foods or refined carbohydrates and things like that. So yeah,
Right.
so
And
I
that
always
was the other thing,
recommend
was
that.
talking about protein intake, right? Protein is so important. And I don't think we get enough protein. And protein has kind of gotten a bad rap. Years and years ago, we were told not to have any red meat, and, oh, protein's bad. It's bad for your kidneys. Don't have too much protein. And, we know that protein is so critical for not only maintaining lean muscle mass, but also building, and also that satiety, right? Being able to feel fuller longer. And
Yeah,
that helps as well with, of sweets and carbs, right? It reduces sugar cravings, all of those things, because it stabilizes our blood sugar. So it really is important. And the nice thing about the Mediterranean diet too is that it can be very easy to translate for anyone who has like a food restriction. So if they, vegan,
yeah,
vegetarian, what have you, there's different things that can be added in, or, pescatarians, that's really the best diet.
yeah,
Tons of seafood and lots of veggies, right? Yeah, it's a great diet, and it's so easy to do because you can get it anywhere. It's just, again, those whole vegetables and protein really is what it is, and good fat, lots of good fat. Yeah.
yeah. And I think, this again, not to belabor it, but I think because I've watched this transformation over the last 35 or 40 years of medical practice, I think what's interesting here is that, oops, I'm just going to get rid of that, is that I've seen this change. Like I remember in the 70s and 80s, the push towards margarine. I
Yes.
remember the push towards seed oils, canola seeds, and they were all wrong. Staying away from butter. You should have margarine, not butter. I remember all this, and I'm going, how stupid were we? And the food pyramids were all
Yes.
wrong. They're all
Yes.
wrong.
They're upside down, weren't they?
Yeah, but now we find out 20 years later that a lot of them were inspired by marketing and by people who had some say in what the guidelines were going to be, that maybe had vested interests in certain food areas, let's put it that way. It's just the weirdest situation. Now we're moving back towards we should allow people to have, lean cuts of meat again and butter and, stay away from seed oils and go back to olive oil and and avocado oil and coconut
Yeah.
oil, and I'm going,
Yes.
gee, we knew this stuff. It just we got
Yeah.
swept up in the drama of the whole low cholesterol. So
And then the low fat, high
low
carb
fat,
fad,
yeah,
right?
yeah, and then
But it was
carbs
funny is
filled in that.
yeah, exactly. But what was interesting is when I'm an 82 baby, and I remember making Christmas cookies with my mom, and we were using margarine. Like I remember the big tubs of margarine.
Yeah,
And recently, my daughter, there was a recipe that came up or something. She had asked, well, what's margarine? I was so proud that she didn't know what that was.
yeah, that's awesome.
This fake butter that you never want to eat because it's disgusting. That's what it
Yeah,
is.
yeah, which was supposed to be healthier.
Yeah, exactly. Yeah, but we learn along the ways, and certainly there's a lot of political influence when it comes to, health and supposed wellness. We've learned that along the way. I mean, hormone HRT is a whole conversation around
Oh
that too,
yeah,
which we won't get into today, but that's part of it too. So it's sometimes going back to the basics and looking at what our ancestors did that kept them healthy and well
yep,
goes a long way, doesn't it? It's really
yep.
not complicated. Keep it simple.
No, it has, but what has changed? I mean, if you look at uh, in the past, uh, things changed around 10,000 years ago when we became not hunter-gatherers, but more sedentary and had field crops and things like that. Our diet changed then. Our genetics didn't change a lot, but our diet changed. And then that's been even more refined over the last 10,000 years, but especially in the last 50 years, it's really changed. So it's interesting to see now people kind of going back to a paleo diet or a keto diet or a intermittent fasting diet, right? Because that's how we used to live as humans. We had periods of fast and periods of plenty, and our bodies are well adjusted to that. You see all the studies on mTOR and all these things, these longevity markers, and it's all based on the fact that we had periods of that we went hungry and we had to clean up the cells and, get rid of
Exactly.
debris and get things healthier again. So it's fascinating to see. This is a fascinating part of medicine. It's really interesting to see what's
Yeah,
going on now.
it's cyclical. It's almost like fashion.
It
All
is
of a
like,
sudden,
it's
bell
kind of like
bottoms.
that. Yeah,
Yeah, bell bottoms are back in style. It's like, wait a minute. We got rid of those years and years ago, like decades ago. But yeah,
yeah.
sure
And
enough. Yeah,
I
it's
always
it's
hoped those
interesting.
never would come back, actually.
Yeah.
So,
You and me
like
both.
wide ties.
Yeah. Exactly.
Yeah.
All right. So
So
tell us
that's
about your third widget.
so my third widget would be hormonal health. So something near and dear to both of our hearts,
Yes. Yeah.
because we delve in that every single day of our existence and help people with that. I think that's really important for lots of different reasons. We'll talk about that, probably later. And then I think restorative sleep is really important too. So I call it rest is medicine or sleep is medicine. But if you don't have restorative sleep, it affects your immune health, it affects your hormonal health, it affects, your cognitive abilities, it affects just about everything. So we need to help people get back to areas when they're struggling for restorative sleep. That's important, I think, as well. What else? Purpose, having a purpose, right? The Okinawans call it ikigai, knowing your sense of purpose in the world, the reason why you wake up in the morning, right?
Exactly.
That's so important. We know that people who live with a purpose live on average 5+ years more than those who don't. So
It's
we know that
incredible. And
people who
makes perfect
volunteer,
sense.
Yeah, people who volunteer lose weights, have less heart disease, have less depression, have enhanced cognitive function, longer lifespans. So, having a purpose, whether it's babysitting your grandkids or whether it's, playing tennis every day or meeting your friends for coffee, or you just have to have a reason why you want to get up in the morning, right? And that's
Sure.
different for everybody. We talked about sleep. So, and then stress. I mean, stress is huge. We've got to modulate stress. And everyone's a little bit different for that. So some people it's walking the dog, other people it's listening to jazz music, others it's, exercise. So that's really important. Stress modification, I think, is hugely important. Supplements. Supplements are my seventh one. So I think supplements are by definition something to supplement your diet. That's what they've always been meant to be. So diet is the core, but then the supplements should fill in the blanks, whatever those
Right.
blanks are for you and for your family. So that's why it's important to know family history, because if you have a strong family history of cardiovascular disease, your supplements are going to be a little different than if you've got a family history of, neurocognitive diseases. So
Exactly.
and that takes a good practitioner to find out your history, your past history, your family history, and your present history, and then kind of tailor your functional medicine supplements specifically to what you need. That's, I think, really important.
Well, we
So
know that
that's
you
important.
really absorb as much, your all of your vitamins and minerals and so forth. The more we can get from our food sources, the better, because it's absorbed a lot easier than taking it in a supplement form. But that said,
Absolutely.
there's certain situations, like for example, women who, or men as well, who are osteoporotic or osteopenic, so have thinning bones, or we know that they have full bone osteoporosis. They need a little more calcium than someone perhaps who doesn't have that history, right? So that's just a very simple example of we really need to customize, supplementation. You don't just go into a Fiddleheads or a Goodness Me and load up on every supplement on the shelf, because first of all, that's not sustainable. It's expensive and you're probably peeing out half of what you're taking anyway. But making sure that you're getting blood work done to make sure that you don't have deficiencies, and also get that good family history, because that's really what makes a difference. Things like
Yeah,
omega
absolutely.
supplementation is really important for reducing inflammation. I love selenium for thyroid health, in women
Hmm.
who have some
Yep.
thyroid dysfunction or a family history of that, or even who are late perimenopause and, have a mildly sluggish thyroid. I like to throw them on selenium. So everything is very customized, right? And that's why it's so important to chat with somebody who knows what they're talking about to be able to guide you. I don't believe in, some of the supplements like a, Flintstones chewable for your children. I don't think there's any benefit in that. I think it's just a candy. But there's a lot of really good supplements out there that people should really be taking, because we know our food quality is not as great as it used to be, perhaps. And if we can supplement and make things better, then why not,
Yeah,
right?
I totally agree with you with that. Yeah, absolutely. And my big one for guys is always vitamin D. Always in the
Yes.
fall, I'm getting them back on their vitamin D for lots of everything from reducing cancer risk. There was about 14 cancers that are affected by vitamin D, and protecting against COVID, helping if you get COVID, helping with healing, anti-inflammatory aspects. But I find it really important. I haven't found a man yet that's not deficient in vitamin D. So even my golfers, they golf, 4 or 5 times a week all summer. They come in September, we do their blood tests, and they're still deficient in vitamin D, from my perception. So I always get them on by. That's important. And then my first responders, they're all stressed. They're all B
Yes.
deficient. So I always get
Yes.
my first responders on B, B complex of some kind. And
Yes.
then for men, ashwagandha is really important. We use a lot of ashwagandha for sleep and anxiety for men, but because it's non-sedating, but also for it helps a little bit with testosterone as well for some guys, not for
Interesting.
all. Yeah.
That's interesting. Vitamin D is, honestly, I eat, sleep, and breathe vitamin D. It's the same. I had one lady actually recently whose vitamin D was 200. And I said, you get a gold star today, because you are the first person that I have seen that has had a vitamin D level really over 100. Because most people are in the 70s, 60s, and of course,
Yeah.
normal lab values, as you know, are like 74 to 250. But it's very rare. I had somebody as low as 10 recently. I
Wow.
just said, go bathe in vitamin D, please.
Yeah.
Take
You
all the
need
vitamin
some
D. Yeah,
as
yeah.
quick as possible.
Yeah,
Yeah.
exactly. So it's critical, but it's interesting. And of course, all these widgets are really clearly laid out. But what I love is that they are all intertwined and so important, right? Like every widget sort of that you described involves even socialization, right? Like you said, it's so important. It's part of
Yeah.
purpose. Having
Yeah.
friendship groups, having, a sense of community is really important.
Yeah.
And I think that it will resonate with a lot of women and men who listen to the podcast because, again, going through perimenopause, menopause is sort of a scary time, lots of changes that you don't really
Yeah.
know what's happening. And having that sense of community is so important to be able to turn to somebody and be able to chat. And it's, again, that's just such an important thing to understand is community, having a good diet, being able to get out and get some exercise in. All of these things are so important. Again, with
Yeah.
the goal of it being that longevity of being able to have that beautiful lifespan that you really envision, right? That is healthy. So again, that health span within the lifespan and having a very short period of time of suffering, hopefully none at all, as opposed to it being the opposite of years and years and decades of suffering with poor quality of life when there really is something that we could have done to improve. And
Yeah.
correct me if I'm wrong, but the sooner you make changes, the younger you are when you make changes, the more impactful they are in terms of living really well in our 70s, 80s, 90s, and so forth, right? So the
Yeah.
sooner you can start, the better.
Yeah. I always say what you do in your 30s, 40s, and 50s plays a huge role in how your 60s, 70s, and 80s play out. So really
Yeah.
important. And
Yeah.
that leads to another widget, which is screening. So there's screening tools that we should all be doing. And that's as simple as getting your blood sugar checked, checking your metabolic health, cancer markers, getting blood pressure checked. Things, easy thing. Getting a colonoscopy when you're in your 50s. You know, there's no reason why people die of colon cancer. If people went for a colonoscopy and they got rid of the polyps in their 50s, and then they have a colonoscopy maybe 10 years later, the polyps would never convert into a cancer, so people would never get colon cancer. So I always talk to my guys about, in your 50s, get for your first colonoscopy, and then follow up with, sometimes it's every 3 to 5 years after that. Usually it's about every 10, but that's really important. Prostate health for guys as well. And then following along with what's in your family. Like if your dad has cardiovascular disease, get checked for cardiovascular disease, right? It just makes sense.
And
So
that's not just a plain old cholesterol panel anymore, right? There's so many more markers and inflammatory markers that we look for too that give us
yeah,
a better sense of how you're converting your cholesterol and overall what the inflammation of your vessels looks like. That's the most important. The cholesterol
yeah,
panel is kind of a passé test, so to speak. I mean, it gives us some good information, but not a ton. Kind of like a thyroid stimulating hormone.
yeah,
Don't even get me started on that. That's a whole
yeah,
can of worms where we actually care about thyroid hormones, not the stimulating hormone. Who cares about that? So yeah, it's really important to understand that. And again, that wraps into family history. So really understanding that. And some people, of course, who are adopted or perhaps their parents passed away at a young age, they don't know their family
exactly,
history. And in that
exactly.
case, these people have to be even more diligent and aware and advocate for themselves that they don't know. So they need to have everything checked in order to make sure that things are caught early and changes can be made quickly.
Yeah, that's that whole preventative medicine thing, right?
Yeah,
And
of course.
unfortunately, the system we have in Canada has always been and was set up this way to be a reactive system. So you have a problem, you go to the doctor, you go to the emergency, you go somewhere, you get it treated, you get better, and you carry on with life. Our system has never been designed to be proactive or preventative. It should be because it makes sense, but it never has been. So it's people like you and I who really believe in the preventative health aspect. We need to just push it. And there's people out there who are interested. They want that. They want to help. They want to contribute to their own health. They want to be partners. And I think that's amazing. And people bring in, Google, studies or things that they pull off the internet or AI now. Great, bring it in. We'll go through it and we'll sort it out together and figure out, is it appropriate or is it bogus? And then we'll carry on from there. But it's a start of the conversation. That's the fact that you're having the conversation, I think, is crucial.
For sure. For sure. And that's
So
a
that's
key
the
part, is
screening.
being a partner in your healthcare, right? It's your provider is only a small portion of it, right? It's like going to the
Exactly.
gym and having a trainer. You only see them maybe 3 times a week, and then whatever you do when you get home is really on you. So you have to be an active partner in your own health. For sure, we can give you the information, but it's really up to you. And again, it's also about getting good information, right, from clinicians who really understand it from more of a preventative health span sort of
Yeah, well, they've
perspective
really
versus
they've carved out that niche of preventative healthcare, right? They really have over the last 30, 40 years have said, okay, y- uh, conventional medicine, you do the reactive stuff, we get that. We're going to do the preventative stuff. And they do, most of them do a fabulous job of that as well, looking at kind of the overall person, not splitting people up into little parcels. You're just a liver, or you're just a brain, or you're just a
yeah,
heart, or you're just a whatever, orthopedics. They try to do the whole person approach, and I think that's important. And we've lost that in our over specialization of healthcare in North America. We've lost a bit of that, but I think it's coming back. I think people are
I think so
starting
too.
to look at the whole person again. I think that's
Yeah,
improving again, so which is
yeah,
good. So that kind of leads
awesome.
to my ninth one, which is uh, stop doing the shit that's killing you. I always tell guys that. Because so if you're smoking, you got to quit smoking. If you're drinking too much alcohol, you got to cut back. If you're doing drugs or overeating or eating too much, refined carbohydrates, we need to get these things better, because if you keep doing that, all the other 9 things that you're doing are going to be less effective. So,
Yeah. Well,
and
that's
then
just
the
it.
then the 10th widget, which you alluded to, is social connections. Right? That's 1 in 4 Canadians are lonely, and the risk and loneliness increases the risk of premature death by 30% and dementia by 50%. So we have to address the loneliness that people have, and especially as people get older, we need to allow people the ability to connect with others. And we learned through COVID how important that was for people to connect with each other, to stay healthy. And again, I think women do a better job at connecting with others than men do a lot of time. But it's not that we can't learn. Men just do things in different ways, and I tell them that you just need an excuse. Male bonding is a weird thing, but guys look for it, but they don't know how to do it. So I always tell them,
Right.
doesn't matter what you do, just create a group. It could be a book group, it could be a woodworking group, it doesn't matter what group it is. The group is just the premise to get together once a month, and you talk about woodworking for half an hour, and then you talk about all the other important things in life for the other hour, right? So it's men sometimes need that, the male bonding, but the socialization package, and it's really important for all of us as we get older. And again, that's where the blue zones of the world have shown us that they do a way better job than the rest of us. You see these little, Italian guys sitting around a table, drinking espresso and chatting with their buddies for 3 hours every day. When you walk through, the towns of Italy,
Yes,
some
exactly.
places just have figured it out.
Yeah, exactly. That's why I try not to give John too hard of a time when he goes for his parking lot beers before hockey games for our kiddos' games, minus the beer, of course. That's the bad stuff. Although I did try to encourage him to get the non-alcoholic beer, and he looked at me like I had 10 heads. He
Yeah.
said, no, thank you. I'd rather have water.
Yep. There you go.
Yeah. I mean, it's important. That's the time when, they kind of get together, and I've walked by a few times and I just think, wow, men and women are so different.
Hmm.
So different. Yeah.
So
Yeah. We're
different.
usually pretty good at calling a girlfriend, or, having a chat whenever we need it, or calling our therapist when we need it. Men, not so much. Right. But that's okay.
And there's a stat I always tell guys too, because I never used to include, like when I did an intake of a men's health patient, I never did a social. What's your social status? What are you doing socially to connect with others, family, friends, and things like that? I never used to ask that, but since COVID, I always ask that. And stress, I always ask stress levels these days. But we know that, I tell them this, that if you don't have at least 3 friends that you can call on a bad day, your life expectancy decreases by up to 8 years.
See,
Yeah. So, and
that's
I cannot
crazy.
tell you how many men do not have 3 friends that they could call on a really bad day or a really bad, week of their lives. It's not good. And especially once they lose their spouse. Like if they lose their spouse, then they're really in trouble. So that's when they need to really be watched and guided and helped.
Well, there you have it. Socialization's important. Let the guys have their poker nights or whatever it is.
Yep, or whatever
they
need.
do.
Yeah.
It's important.
Yeah. Yeah.
Healthy poker, right? With veggie sticks and non-alcoholic beer.
Yeah. Well, I had to learn from a good friend of mine probably about, 15, 20 years ago. He talked to me and he said, you know what? I looked around once. I was having a really bad time. And I looked around and I didn't have anyone I could really think to call. And he said, you know what? I knew then that I had to change things. And I listened to him. I said, that is a great idea. So that was about the time I have a men's wine group that we meet monthly. And then I've got a men's book club that I created that we meet monthly. And after 15 years or almost 20 years of meeting, we know each other really well. So we still go and we'll talk about the book for a little while, but most of it's about, okay, what's going on with you? Your son's got mental health problems and what's happening with that, and how is your wife's health coming now? And so it's more important that way, the socialization and the connecting so that they know that they have someone to call if there's a problem. But you have to create it. You have to start it. And once you start it, if you keep it going, then it's just so important.
There really isn't anything more cathartic than connecting with a human being that you feel cares about you and cares about what's going on. That is very, very important. So it's not surprising. It helps to reduce stress levels and really cortisol in our bodies. We know that positive connections do that, right?
Sure does.
Yep. Yeah, so it really, really important. But, well, thank you, Dr. Fallis, so much for all of that information. I mean, they are little changes or little things that you don't really think about, but how impactful they really can be lifelong and in terms of, years and years and years to come of how that will affect us. So I really hope that everyone can take, a little bite away from one of your widgets at least and make some changes that are be positive.
Start with the easy ones. Start with the easy ones.
Yeah. And, also it also is a good little checklist to see how well we're doing too, right? So we always talk about the changes we need to make because we're not doing a good enough job, but really a lot of us are doing a really good job in a lot of areas. It's just modifying some of the areas that we're not doing so great, right? So this is a nice little checklist and a little pat on the back, like, hey, I'm doing really well in the socialization aspect or, the physical aspect, all of that stuff. So it's really just tweaking it for a better, longer, a healthier health span.
Yeah, and telling guys that too. I think that's a really good point you bring up because I'll get guys come to me and, for hormone health and whatnot. And I'll sit down at the end and I'll say, look, you're doing intermittent fasting, you're exercising 5 to 8 hours a week. You're trying to get 7 hours of sleep a night. You're starting on hormones. You're taking these supplements. You are doing better than 95% of the men out there at your age. You need to know that we can improve things, but you are doing better than most, and you just need to keep doing what you're doing. And sometimes that reflection and that comment to them, they have no idea how they're doing compared to everyone else. But because I see so many people, I can tell them, you are doing a great job. Keep doing it.
Yes, exactly. Keep it up, right? That's great. Yeah, it's positive, right? It's getting that reassurance, especially from somebody who's, so well respected in the industry and knows what they're talking about. It's a positive thing. Again, we're aiming for 90% on those exams, right? We don't want to be the mediocre, just passed at 55. We want the 90. So all about optimization. So
absolutely.
Thank you so much. And we are going to bring you back in a couple of episodes to talk about men's health specifically, because I have a ton of women that always ask me about their husbands. Okay, so what can my husband do? And how does my husband's health differ from mine? And tell me about testosterone, because of course I am a fan of testosterone for women who have hypoactive sexual desire disorder. We do use that quite a bit. We also use it for vaginal dryness. It helps with that. But of course, I am currently not seeing men, and I refer everyone to you. So I'm going to bring you back on and we're going to chat about men and how they differ and all things testosterone. So stay tuned.
Great.
For
One of my favorite topics.
Yay. Thanks everyone for listening. I hope you have a fabulous day, and we'll see Dr. Fallis back in a couple of episodes. Take care.